What is a heel spur? A heel spur is a bony outgrowth that can occur on the underside of a person's foot. They are also known as calcaneal spurs or osteophytes. Heel spurs may be pointy, hooked, or shelf-like. The outgrowth of a heel spur extends from the underneath of the heel towards the arch. This area of the foot is called the plantar fascia. Can you get rid of heel spurs? It is not possible to get rid of heel spurs without surgery. However, some figures suggest that heel spurs only cause pain in 5% of cases. If someone is experiencing heel pain, there may be another cause. According to the American Academy of Orthopedic Surgeons, the most common cause of heel pain is plantar fasciitis, which occurs when the tissue that supports the arch of the foot becomes inflamed. Heel spurs are bony growths that extend from the heel bone to the arch of the foot. According to the AOS, only 1 in 20 people with heel spurs will experience pain. However, heel spurs do cause pain in some people. The symptoms of a heel spur can include pain, inflammation, a bony protrusion, tenderness on the bottom of the foot. Plantar fasciitis and heel spurs often co-occur. In 2012, researchers found that 89% trusted source of people with plantar fasciitis had heel spurs. Additionally, the authors of a 2015 review suggest that heel spurs may develop as a reaction to plantar fasciitis in some cases. The symptoms of plantar fasciitis include pain on the bottom of the foot, near the heel, pain after a long period of rest or after sleep, pain that gets worse when flexing the foot, greater pain after, but not during, exercise. Treatment. The only way to get rid of heel spurs entirely is by having surgery to remove the growths. However, doctors typically reserve surgery for cases that do not respond to any other treatments. According to the AOS, surgery is a last resort because it can lead to chronic pain. However, there are things that people can do to reduce heel pain and inflammation, such as rest, cold therapy, non-steroidal anti-inflammatory drugs, exercises, supportive shoes, corticosteroid injections. A doctor can diagnose the cause of heel pain by performing a physical examination and X-ray to rule out other conditions, such as arthritis or fractures. Exercises. According to a 2015 review, physical therapy can help people with heel spurs improve their range of motion and keep their joints mobile. The AOS recommend trying the following exercises for 4-6 weeks, under the supervision of a doctor. Towel stretch. To perform this stretch, sit on the floor with the legs straight out in front. Wrap a towel around the ball of one foot and pull gently inward until there is a stretch. Hold the stretch for about 30 seconds and repeat 3 times. Repeat on the other foot. Heel cord stretch. For this stretch, with the hands on a wall, place one leg forward with a slight bend in the knee. Place the other leg slightly behind the body and keep it straight. The heels should remain flat on the ground. Press the hips forward to feel a stretch in the calf and heel of the back leg. Hold the stretch for about 30 seconds. Switch the legs and repeat. Towel curls. For this stretch, sit on the floor with the feet flat on the ground and place a small towel in front of the feet. Grab the towel using the toes on one foot and bring it closer to the body. Relax the foot and then repeat 4 more times. Switch to using the other foot. Golf ball roll. For this exercise, sit in a chair and roll a golf ball under the painful foot. Continue for several minutes, without extending the leg too far from the chair. If the pain is in both feet, repeat with the other foot. Ankle flex. To perform this exercise, sit in a chair with the feet not touching the floor. Write out the letters of the alphabet with the feet, using only small movements in the foot and ankle. Perform this exercise in one foot and then the other. Causes and prevention. According to the American Podiatric Medical Association, heel spurs occur due to muscle and ligament strain in the foot. Repeatedly tearing or damaging the membrane that covers the heel bone leads to hard calcium deposits building up over time. Heel spurs can happen as a result of the repetitive stress that some high-impact exercises, such as running, place on the feet. Other causes and risk factors include biomechanical imbalance, tight muscles in the calf or foot, high arches, and gait abnormalities can lead to heel spurs. Shoes that do not support or fit the foot well may also contribute to their development. Obesity. A review article trusted source notes that 2 meta-analyses found that a higher body mass index and heel spurs are associated with chronic heel pain. Age. According to a 2014 study trusted source, large heel spurs are more common in people over the age of 40 years. People can reduce the risk of heel pain by wearing supportive shoes that fit well, wearing shock-absorbing shoes when exercising, warming up and stretching the legs and feet before exercise, maintaining a moderate weight,